Hello, everyone, and welcome to the Healthcare Wayfinders podcast, where we are routing you to more accessible and cost-effective healthcare. I'm your host, Zach Aten, and today we're talking to a medical innovator helping to make it easier to access and pay for specialty healthcare services. What happens when a patient is willing to pay cash for care, but the doctor's office still can't tell them what their care costs? That's the problem today's guest, Dr. Michael Havig, kept running into in his office as an orthopedic surgeon. Friends, neighbors, and small business owners in his community were trying to make smart decisions about healthcare, but the system wasn't built to give them the simple answer to a simple question: how much will this cost? So Dr. Havig started building a better way. In this episode of the Healthcare Wayfinders, we will talk about HealthMe, a platform helping medical practices create bundled prices for direct pay patients. We get into the why cash pricing can sometimes be less expensive than using insurance, how patients with high-deductible health plans may still benefit from direct pay options, and why changing where care happens from hospitals to high-quality outpatient settings can create major savings. If you've ever felt like healthcare pricing is confusing, unpredictable, or impossible to shop for, this conversation will help you see what a more transparent and consumer-friendly healthcare system could look like. Let's dive in. Hey everybody, welcome back to the Healthcare Wayfinders. This is Zach Aten, your host, and I'm here with Dr. Havig from HealthMe. How you doing, Dr. Havig?
Yeah, I'm doing great. Thanks for having me.
Yeah, welcome. Well, I'm excited to share what you guys are doing with our audience at HealthMe. Why don't we start by talking about, tell us a little bit about yourself.
Yeah, so I'm an orthopedic surgeon, sports medicine specialist. I practice in Florida, practice in my hometown actually here after a kind of journey, college in the Northeast and then med school in the South. Spent some time in your hometown or where you're located now in Atlanta at Emory University training in orthopedics there, and then sports medicine fellowship out west. And anyway, moved back to practice in my hometown, and that's really where I became aware of a lot of the issues that self-pay patients have when dealing with medical practices.
Yeah, so let's dive into that. Like in your practice, what were the problems that you were seeing your self-pay patients have?
Yeah, so here's the interesting thing. I think there's nobody that's really happy with the way healthcare is, transacted. There's generally very little, if any, pricing transparency around healthcare costs. I know you're working on in the lab kind of vertical on this to try and improve things. And people have done it in imaging, I think, in labs. And again, it's just the tip of the iceberg, I think, that we're all solving for. But one of the problems I saw is because I practice in my hometown, many of my patients are friends of mine that I've known for my whole life, or through high school or middle school or elementary school, or they're family friends. And many of my friends are small business owners, right? So they might be a contractor, they might be a realtor, they might own a restaurant, they might, own a plumbing company, they might be an entrepreneur like you. And many of these folks, they've got great jobs and great companies that make good money. And they elect not to carry health insurance, not because they can't afford it. Most of them can. They just make a value-based decision that it doesn't make sense for them particularly when they're young and healthy, to spend $30,000, $40,000, $50,000 a year in premiums and deductibles before they actually see a benefit. So I was talking to a friend of mine who's a realtor, and he said, gosh, I have 2 kids, my wife, we're healthy, we're in our 30s. I'm paying essentially $40,000 a year because I'm paying, whatever it was, $2,500 a month in premium, and then he had a $5,000 deductible or $10,000 deductible at the time, and he's just like, isn't there a better way to do it? And I said, yeah, there probably is. And at the same time, we started the conversation because he was explaining to me why he didn't have insurance, right? And the reason he was explaining that to me is because he had called my office because his kid got hurt playing soccer or something, I don't remember, tried to make an appointment to see me. And since he didn't have insurance, but was willing to pay cash, he wasn't looking for charity care. He was just like, hey, I want to see Dr. Havig. I don't have insurance. What's it cost? And my office turned him away, actually. Unbeknownst to me, we had a self-pay policy in our practice, just like every other medical practice does. Everyone's got a self-pay policy, right? And that's often, hey, we're going to charge Blue Cross rates or United Healthcare rates or whatever, which is great. That's a good solution potentially, but it just doesn't work. And the reason it doesn't work is healthcare is retrospectively priced. So if you call a medical office and say, what's it cost to see the doctor? Generally, that person on the phone won't be able to answer that question because it depends if the doctor spends 5 minutes or 50 minutes, or reviews an MRI or lab tests, or it depends on how much work they do.
Yeah.
And that amount of work gets translated into a CPT code, which for the listeners who aren't in the healthcare space, that's a billing code that goes into a computer system. And all those numbers get added up. And at the end of the day, maybe the bill's $1,000 and an insurer might pay me $250, right? So nobody knows this. So it wasn't that my staff was trying to be difficult. It was just I hadn't empowered them to be able to answer the question. And this happened time and time again, and it drove me nuts. And I finally, everything I just said, I didn't understand at the time. And I finally figured out, like, okay, if we want to give someone a price for a product, it could be an iPhone, it could be a computer, it could be a lab, it could be an office visit in healthcare. You need a product, and that product is a healthcare bundle. And so I bundled everything I do, because at the end of the day, there could be a million different permutations of what I do when I see a patient. But the bottom line is 90+% of the time, I do the same thing.
Yeah.
I might order an x-ray, I might do this, I spend X amount of time. And if you can just say, okay, the average that I do is this, that's the bundle. In my office, It was the first thing I built was a knee bundle. Visit with the doctor, x-ray if needed, plan to get you feeling better. And now that you have a product, you can use data to price it. And now that you have a product and a price, you can retail your services like everything else in the world. So that's where I started, really just solving that problem for my practice. And, it, just worked basically. So I built some software around making that easier.
Yeah.
Anyway.
So is HealthMe primarily a tool for providers, a shopping platform for patients, or is it both?
We're a B2B2C company. It's really both. I mean, it started as a shopping platform for patients because I thought, okay, so I bundled and priced what I do in the office and ultimately other services we have, imaging, physical therapy, surgeries. And I did this really just to solve the problem. And then I realized how much business it grew for my practice, right? Because guess what? My friend, the realtor, tells his other realtor friends who are kind of self-insured, if you will, and the contractors do the same and the restaurant owners the same. And it generated a lot of business, but the operations around it were somewhat cumbersome. And so I built tools to solve that. And I said, okay, other doctors want to use this now. I started getting other people signed up, and I thought, I'll put them in a marketplace in front of patients. Here's the problem. It's kind of just slow to get people onboarded. The doctors didn't quite understand it. And many of them told me, like, gosh, I don't know if I want my pricing next to my competitor, but I would love to just have this as a functional tool for my practice, right? To be able to have a marketplace, kind of like Shopify might do for a small business owner. We help them bundle, create their SKUs, if you will, put them online, give people more ways to pay, collect the money up front, pay the provider immediately. And so when we did all this, what it does is it opens the door for the providers to enter the market and serve the patients who are already reaching out to them. So we're kind of serving a demand overhang in the market, if you will. And so that's where we started, and that's kind of where we are today. But the way we interact with consumers is they're generally, just like my friends were calling my practice, consumers in other markets call those practices. And instead of getting turned away or quoted a crazy high charge master or getting a different answer every time they call for the same thing. Now it's all standardized where the staff might say, hey, Zach, no problem. We got a great program for direct payers. You want to see Dr. Havig about your knee? What's your cell number? I'll send you a link right now to buy the knee package. It's $300. It includes the doctor visit, an x-ray, plan to get you feeling better. And you'd open up your phone and it would pop up and you'd Apple Pay, Google Pay, finance it, whatever you want to do. So that's how we've kind of consumerized it. And ultimately, I think it'll come full circle back to a consumer-facing platform, but we needed to stock the shelves and that of the store, if you will, before it's interesting to consumers. And we've basically gotten pretty far down that road now.
That's awesome. So it obviously benefits someone who's like truly like uninsured, direct pay user. What about someone who's like functionally uninsured, where they have like a high deductible healthcare plan? Can they use your product too, or do they have to go through their insurance, or how does that work?
Yeah, that's a great question. I get asked that all the time. In fact, by a lot of physicians and medical practices, because they're not sure they can do it. They're like, well, what if the patient has Blue Cross? I'm in network with Blue Cross and they want to buy this instead of use their Blue Cross. The answer is yes, they can use it. So federal law back, I think the legislation, I can't quote you the exact legislation, but back in the 2000s, some omnibus healthcare act, and again, I don't remember the number, they gave patients the ability to opt out of their insurance, pay directly for their healthcare, and then they can opt back in. They can opt in and out. And part of the provision of that law says that the patient requests that none of that information is sent to their healthcare. So if the patient opts out, they can provide they can pay for their care, and it doesn't have to be put in front of their health insurer. And in fact, I think part of the thought behind this law is there are people that say, look, it's kind of like if you get a ding in your car and you decide you're not going to use your car insurance because you don't want your premium to go up.
Yeah.
It's the same philosophy when they created this law. So you can do it. And so we kind of give the practices that we work with, the medical practices, the confidence that they can do that. We often educate them about this law because they didn't know they could.
Yeah.
They can offer prompt pay discounts. It's not illegal to do that. You can.
They're afraid of making Blue Cross Blue Shield angry or something like that.
Yeah, exactly. They don't want to run afoul of these insurers, but federal law protects them. We, in fact, supply the waivers to the patient to sign digitally when they do this. So the practices feel very comfortable doing it. But that was one of the big hurdles when I started doing this for medical practices. They're like, is it legal? Can I do it? Am I going to get in trouble with my insurance companies? And the answer is yes. You can better serve your community. You can give people access to the fine care you're providing. You can do it for a reasonable price and not get in trouble with the insurers and whomever else, right, that you're worried about.
Great. So what I hear you say is whether I'm truly uninsured or I'm functionally uninsured on like a high deductible healthcare plan, this is something that I can use if my provider uses HealthMe in their practice, basically.
Yeah, that's correct. And when we look at the data, it's about 30% of the people who purchase on our platform have insurance. Like we ask them on the checkout if they're insured or not. And about 30% of them are insured, and they're electing to go down the path that we just discussed. Because often, interestingly, and you understand this from your work that you're doing with labs, is it's often less expensive to pay cash for something than it is to go through your insurance. For strange reasons that we could spend probably hours discussing, but maybe don't have the time to take a deep dive on it today. But yeah, healthcare is idiosyncrasies that don't make sense to a lot of people in the real world.
So where does the actual savings come from? You just mentioned that it can often be, cheaper to pay, self-pay direct to the provider, not worrying about insurance. Like, is it administration? Is it convenience on the provider side? How is it that, you're able to offer, a better pricing, or where does it come from, I guess, for the consumer to understand?
Yes, there's two things really. I think for what you're explaining, a lot of it is the administrative burden, right? So if you look at any of a number of studies that have been done over the years on this, they say, what's the cost for me to collect $1 as a physician in my practice? And it's anywhere from really 10 to 40%, depending on the study or the consultant you look at. It depends a lot on the service, right?
Yeah.
For surgeries, it's a lower percent because it's a higher ticket item. For office visits, there's a study published in the Journal of the American Medical Association back, I want to call it 2018 or 19, that was done at Duke University, that showed it costs approximately 15% of every dollar to collect on an office visit, right?
Wow.
And there's other studies, McKinsey, big consulting company, and other studies they've done have shown it's as high as upwards of 40% for the administrative burden. So there's also the time value of money that people talk about, right? So if I say I'm going to bill $1,000 to 10 different patients for an office visit, I'm just making this up, or say I bill $100,000 over a long period of time, there's a certain amount of that that's not going to be collected. Let's call it 20%. Then there's that, it takes 30, 60, 90 days or more to get paid by an insurer after they jump through, go through all their machinations to try and hang on to their money. And then there's a certain amount of patient responsibility involved in that we may or not be able to collect as well. And so if you kind of look at the big picture, getting money in the bank on the day of service is kind of what we guarantee the doctors. And so we need to incentivize the doctors to be able to offer good rates, right? And one of those is with our platform, if you're the consumer, buying a healthcare package is the same as buying an airline ticket or something, right? You buy it up front, the money goes to escrow. When you see the doctor, they enter a redemption code, verify that you've been seen and received the service before they're paid, right? And so that way they get paid instantly. Yeah. They're getting they could offer at least a 15% discount according to the Duke study, and more based on other studies. So that's the main kind of factor that allows the doctors to offer better pricing. The second thing I will say that's slightly different, but if you're a self-funded employer, we help direct care from self-funded employers to our client practices. And one of the values there is everything we just talked about, but they also see value in being able to change the site of care. So for example, we often look at claims data for self-funded employers, and we did a claims analysis for a county sheriff's department in the not too distant past, and they were paying an average of $8,800 for colonoscopies. They're all being done at the local hospital. Wow. When as an outpatient, that could have been done for a little under $2,000, actually more closer to $1,500. And so they could have saved, what is that, $2,300 a colonoscopy, or excuse me, $6,300 a colonoscopy times hundreds of those being done, right? And so again, changing the venue of care. That can be it's the same doctor, same quality. There's no sacrifice in that. And same thing in orthopedics. Like if I do a procedure at an outpatient surgery center versus the same outpatient procedure at a hospital system, the changing just the site of care will lower the cost 3 to 5x. So. Yeah, that's awesome. So
Yeah, that was going to be kind of my next question around, this has to be great for, a large self-pay employer or something like that, being able to connect folks there. Does this work for like all medical specialties, or do you see it being adopted more in, primary care versus orthopedics or vice versa?
Yeah. I mean, traditionally, the primary care docs are kind of out leading the charge here, I think. So I think they were under more pressure earlier from a reimbursement standpoint and other things. So if you look at, direct primary care, DPC, right, it's a growing trend where many primary care doctors, they're opting out of the traditional third-party payer.
Yeah.
And they're charging a monthly subscription that's reasonable, right? You might pay $80 a month or $150 a month for a family, $80 a month for an individual, or somewhere in between, where that includes, your annual checkup. It includes X number of visits for sick care. And then when you need labs or x-rays or things like that, those have transparent pricing right there. And they probably partner with companies like yours to offer those labs at a better price, right? And so the specialists have been slower to come to that. And that's what we're really enabling. We're enabling specialists to what we call direct specialty care, right? Where they're not going to be on a subscription model like that or have a panel of patients. Because most of us as specialists, we see a patient, we get them better, they're out of our system, right? We're not building a panel of patients over a period of time. But if we can offer just transparent pricing, we can take good care of these patients, offer them high quality care at a lower price. And so the specialists are moving into it. If you look at specialties that could offer this, really any specialty could. I mean, the things that aren't really kind of priceable, if you will, are kind of high acuity, healthcare, things like, significant trauma, right? Auto accidents, high acuity sick care and ICUs, things like that. But honestly, I've seen people bundle open heart surgeries. I've seen people bundle cancer care. Wow. We're just starting into that kind of stuff, but there's very complex things that you think you couldn't build a bundle around, but they're bundleable. And, it's pretty amazing. Like, I mean, I would say just, in the data, I have data that supports this, about 80% of the healthcare episodes that people receive are probably shoppable, priceable and shoppable. Now, that doesn't mean 80% of the entire healthcare spend, because a lot of the healthcare spend are on these high acuity in hospital, things for very sick people, right? But if you're a self-funded employer and your employee base is 19 to 64, which is kind of traditionally what's looked at, there's a huge opportunity to save in your big three, which are musculoskeletal, one of the big three, and that's where we started, and we've built the largest network of transparently priced bundled musculoskeletal care, women's health care, which we're entering that space in a big way, and we're starting to onboard more women's health care groups. And the top one is usually, cancer care, which is a little more difficult, as I just mentioned, but we're actually partnering with a number of independent infusion center networks to be able to, at least once the patient has their diagnosis and treatment plan put together, we can save employers and patients hundreds of thousands of dollars on the infusions by moving those to an outpatient independent setting as opposed to a hospital system. And nothing against hospitals. I don't mean to beat on hospitals. They're very expensive venues of care. They're very necessary for caring for acutely ill and sick people. But I think we need to move a lot of the, that doesn't fall into those categories to high quality, often higher quality, independent venues and outpatient centers.
It's really cool. So do you really see care being able to go long-term towards these bundled services for self-pay folks or functionally self-pay folks?
Yeah, definitely. And even the employers, like if you look at the employer, so there's about roughly 165 million Americans with employer-sponsored healthcare, right? And so they might carry a Blue Cross card or United card or Cigna card, but what many don't understand, and I didn't prior to a number of years ago, is the employer's paying the first big chunk of that, right? So I might walk in if I work for Walmart and throw down my United Healthcare card, but Walmart is elected to pay the first, and again, I'm making up this number, I don't know the details on Walmart, but they may say, hey, we're going to pay the first $200,000 of this employee's healthcare. And there's an aggregate amount. In smaller companies, the average amount that the employers pay is about $75,000 when I talk to stop loss companies. So imagine you have 100 employees. You might be on the hook for $75,000 for each of their care. Now, there's an aggregate too. They might cap it at $5 million or whatever, right? But if you're very incented as an employer to try and steer these people to the $5,000 knee arthroscopy or the $7,000 hernia repair as opposed to the $30,000, $40,000 or $50,000 procedure at the hospital, or get labs through a company like yours versus the hospital lab, or get an image at an independent imaging center versus the hospital and imaging center. So I think to answer your question directly, are self-pay patients going to change the way healthcare is bought and sold at scale? They could, because it's a big group, but I think the people who are really going to change healthcare for the better into a system like this, it's going to be the employers, because they're the ones that hold the purse strings, right? You know, the old saying, he who has the gold makes the rules. Like, they are in control here. And I think they're waking up to the fact that the way they've paid for healthcare over the last number of years is not working. And it's not sustainable, right? It's just not sustainable for anyone. Not for patients, not for employers, and certainly not for physicians either. We're all kind of in the same boat and really need to kind of blow up the system and reinvent it around direct pay.
Well, I think that's a great kind of close to this. We didn't have time to talk about good faith estimates, but you know, listeners, you got to check out HealthMe. It's amazing the work that you're doing, Dr. Havig. Really appreciate you being on the show.
Yeah, I really enjoyed it. It was a lot of fun, and always love talking direct pay healthcare with other innovators in the space like yourself. And we should chat again after, maybe not for the podcast, but this way we can work together, actually.
Yeah, well, we'll definitely look about having you back on, and really appreciate your time. Thanks for the work that you're doing.
Yeah, thanks a lot.